What is worse, a hurricane or a poor diet? The choices may seem incommensurate. Nevertheless, the question allows us to reflect on our perception of risks to health and harms to life. We will never know how many lives were lost in the aftermath of Hurricane Maria in Puerto Rico. The conservative estimate of a government-funded study was 2,975, a number not paralleled since the 19th century. On the other hand, the World Health Organization has estimated that 2.8% of deaths worldwide are attributable to low fruit and vegetable consumption. Based on that, we can expect diet-related fatalities in Puerto Rico to be at least 797 annually. Every year, our diet may cause more fatalities than those in any but 2 recorded hurricanes. The aim of the UT Health Ambassadors Project has been to address the very wicked problem of achieving a healthy plate in the Puerto Rican diet. This aim faces the seemingly insurmountable hurdles of food insecurity, natural disasters, and the disasters of centuries-old colonial relations. The Healthy Eating Plate, published by the Harvard School of Public Health, represents a balanced diet as a plate where half is occupied by vegetables and fruit, a quarter with carbohydrates, and a quarter with protein. Compare that with the latest information on the Puerto Rican diet. Almost half of people consume 1 or less portions of fruit a day and less than 2 portions of vegetables a day. More broadly, the State of U.S. Health 2018 report, published by the Journal of the American Medical Association, has stated that dietary risks are the main risk factor related to deaths in the U.S. over tobacco use, high blood pressure, and high body mass index. According to the USDA, over 47 million people live in food deserts, as defined by distance from the supermarket, lack of transport, or socioeconomic status of the community. People who live in these areas in the US may die up to 15 years earlier due to the health consequences of malnutrition, also referred to as food apartheid. Food deserts may occur on tropical islands. In Puerto Rico, in 2015, an estimated 33% of the population regularly experienced limited or uncertain access to food. 1 out of 3 persons around us faced hardship in maintaining an adequate diet. After the start of the pandemic, food insecurity has reached as high as 40%, with many adults skipping meals to make sure their family had enough to eat. Puerto Rico is set apart in the way it receives assistance from the US government. Thus, it was left out of the first round of pandemic nutritional assistance. And while state programs grew by 17% in 2020, program benefits in Puerto Rico contracted by 40%. Being set apart can become food apartheid. Currently, Puerto Rico produces only 18% of its food supply. Interestingly, in a 2020 interview, then Secretary of Agriculture stated that Puerto Rico has enough land reserved for agricultural production in order to feed our population, according to United Nations guidelines. We have 634,000 acres reserved. We only need 600,000. Nevertheless, the Secretary added that food autonomy was impossible given the protein and carbohydrate focus of our diet. We do not have enough land to sustain our current diet. We have enough land for all to enjoy a healthy plate. The goal of our project has been to increase knowledge and access to healthy eating options at the Gurabo campus of the Universidad Ana G Méndez. Our team is composed of faculty and students from psychology, social work, and naturopathic medicine. We determined that knowledge of basic health promotion was necessary, as well as an understanding of eating as a psychological, social, and political phenomenon. The published literature on initiatives that successfully promote the consumption of vegetables and fruit points to exposure and access as key factors. Our own data reflects that affordability presents one of the main barriers in our community. The first component of our project is the Healthy Food Oasis. These consisted of a free lunch following healthy plate guidelines, surrounded by informative lectures and kiosks of local artisans and farmers. With these, we have served 1,625 participants on 27 different occasions. The second component of our project were learning modules on nutrition, gardening, self-care, and leadership. Upon completion of the modules, participants received a certificate and a food or gardening box. With these, we have reached 285 students and staff. Train the Trainers modules aimed at student associations and administrative staff were also developed to increase leadership for the continuity and expansion of our project. The third component of the project were the school gardens. These model spaces for gardening, learning, and bathing in nature were designed for sustainability, ease of maintenance, and cultural significance. Against drought, pandemic lockdown, and over-eager weed whackers, we transformed the typical lawn in front of the psychology clinic into a green classroom surrounded by a tiny farm. In bringing the project home and adapting to the pandemic, we literally brought it home through online education and home deliveries of food and gardening supplies. A garden was one of the few things in prison one could control. To plant a seed, watch it grow, to tend it, and then harvest it, offered a simple but enduring satisfaction. The sense of being the custodian of this small patch of earth offered a taste of freedom. Nelson Mandela. We would like to propose small ideas like seeds, passion fruit for the heart, pigeon peas for your muscles, and plantains because they make Puerto Ricans happy. We would like to propose that 600,000 acres of our lands, as well as our patios and balconies, be filled with seeds. We would like to propose that community and family pantries be stocked with the produce of those seeds. We would like to ask you to fill half your plate with vegetables, a quarter with whole grains and roots, and a quarter with protein. We would like to ask you to help ensure that everyone can always enjoy a full plate. Plant seeds, share meals, break chains, build bonds. Since I received the gardening box, I have continued taking care of my garden. It was a really super initiative. I have already harvested from what I planted. Carol, university student, and now home gardener.